And then, all right, I'm going to hand it over to you, Jane.
Hi there, everybody. Welcome. Happy Monday. And actually, the sun is considering coming out, so that's a wonderful thing. It hasn't been as regular as usual. I'm happy to introduce and welcome Sarah Landis and Dr. Justis Ortega. Um, Sarah is an OLLI instructor and professional PT person. She has several degrees. She's a pelvic floor physical therapist. After completing her undergrad and master's in Humboldt, test them. She went on to complete her doctorate in physical therapy at University of St. Augustine. She then returned to Humboldt County and has been practicing physical therapy for 10 years. She earned her Women's Certified Specialist designation in 2022 and runs her own private physical therapy practice called Axis Physical Therapy. She's also the director of the Biomechanics Lab and a lecturer at Cal Poly Humboldt. As the Biomechanics Lab Director, she works to help students and community members learn about the limits of stability and how we can decrease falls in our community. Her research is centered around rural fall risk and helping seniors stay independent for as long as possible. Dr. Justis Ortega, the Associate Dean of the College of Professional Studies at California State Polytechnical University in Humboldt, Cal Poly Humboldt, in Arcata, serves as the director of both the North Coast Concussion Program, director of the Cal Poly Humboldt Fall Prevention Program, and affiliate research in the Cal Poly Humboldt Biomechanics Lab. He's got many hats. Yes, switches them often or puts them on all at once. His biomechanics research focuses on factors that influence locomotion, mechanics, and efficiency. He's currently conducting a series of studies exploring the myths and science of running. At the Cal Poly Fall Prevention Program, he's working with local health agencies, including Area 1 on Aging, Humboldt County Public Health, and United Indian Health Services to provide fall risk assessments and fall prevention classes for North Coast seniors. In his most recent research studies, he and his students assessed and mapped, GIS mapped, the fall risk and fall prevention needs of seniors 65 and over across Humboldt and Del Norte counties. At the North Coast Concussion Program, he provides concussion education and diagnostic services for over 20 schools at Northern California, including all K through 12 schools in Humboldt and Del Norte counties, local community colleges, and Humboldt State University. As part of his service, he and his team provide concussion education and testing services for 4,000 plus athletes, coaches, and parents. You end up wondering how he pulls all this off. He integrates his expertise in neurological control of movement and traumatic brain injury to investigate the effects of concussions on neurocognitive and motor control function. He also has a research interest in the impact of concussion management practices on incidence and recovery of concussion in youth sports, which has been very major topic of late because of the concerns. For the past several years, he's been working collaboratively with 30 other universities around the country as a member of the NCAA DoD CARE Consortium to gain a better understanding of the biopsychosocial nature
Yeah.
of concussive
Yeah.
injury and recovery in order to ultimately enhance the safety and health of our student athlete, service members, youth sports participants, and the broader public. Dr. Ortega has also been working with the CSU Chancellor's Office, CSU System-Wide Risk Management, and each of the 23 CSU campuses to assess and provide concussion injury management in accordance with California state laws, NCAA rules and regulations, as well as international and interassociation best practices. Now, I normally would not read anything this long. However, this gives you an idea of the scope of the work that Cal Poly and through Dr. Ortega is doing across all these areas that are of significant interest. And for the most part, we have no idea what's going on in these kinds of areas. So I read all that so you would understand the kinds of work we're doing and can be proud of at Cal Poly. And if you want to inquire further, you can do that and you'll know where to go. Thank you very much. I'm going to stop reading, which I stumbled several times, and turn it over to Sarah and Justis. It's all yours.
Excellent. I'll go ahead and get us started. Thank you all for taking the time out of the middle of your day and enjoying hopefully your lunch with us. Hopefully you are really eating lunch. Um, yeah, again, my name is Justis Ortega, and I'm here with my, I think, very esteemed and I love my partner in crime, um, Dr. Sarah Landis, who is an exceptional practitioner. And I think the one thing that just hearing that, and thank you, Jane, for sharing that, because I think it sort of, if if I distilled all that down, the one thing that I feel so proud of about where we're at Cal Poly Humboldt and have been this way at Humboldt State University is the character of who we are in terms of trying to connect learning to giving and doing service to our community. And that's a critical piece of who we are. And I think our college and at our level of our departments and our programs is that's really kind of come to fruition. And due to a lot of hard work from a lot of different folks. And I'm just one very small piece of that puzzle. But today I'm really excited because Sarah and I get to share with you a journey, actually, quite frankly. It's a journey that explores falls and the history of falls here in Humboldt and Del Norte County and what we've learned through our research over the last literally 20 years about. My background prior to Humboldt was I studied specifically how the nervous system in older adults changes and how that impacts how we control our movement, and particularly how we walk and how we balance. And when I came to Humboldt, I continued that research. And as I was doing that research and working with our older community here in Humboldt, I was realizing a lot of the folks had had a lot of falls. And they were saying, well, what do you know about falls? What do you know? How can I stop falling? And it was right around that same time, literally when I first came here, that I met Sarah. And Sarah and I started this journey together. We basically started the Humboldt State University Fall Prevention Program together when she was a student and I was her mentor and faculty member. And what our goal was to take all this like basic science research and let's start actually being more applied and integrate learning research with actually providing services to the community. And that's what we're going to share with you today. We're going to discuss broadly falls and where we're at as a community, as a society around falls. And then we're going to share with you the results of two key studies that we did here at Humboldt, one that was led by Sarah Landis and one that was later led by a woman by the name of Michelle Lopez, who is now studying to be a physical therapist. And then we're going to finish by really talking about the future, where we're going and what we're doing and what's available to our community and how that integrates into some of the things that are happening at Cal Poly Humboldt. And we'll pause along the way. If you have questions, you can throw them in the chat for those who like to use the chat to ask your questions. If you just want to like jump in and you got a question that you really need that answer, just raise your hand. And I think between the OLLI folks or Jane, Sarah, or myself, we'll capture that and we'll try to get that answered. Or you can just wait to the very end and we'll make sure we have some time to do that. So with that said, I'm going to go ahead and jump right in. Sarah, did you want to say anything before we get started?
I'm excited. I'm excited. It's always a good time to just kind of share a little bit about what we're doing. And it's exciting because, as you said, it's all about bringing the community together. And I think that's a big thing that we're striving for and always working towards.
All righty, let's get started. I'm going to share my screen here. And hopefully folks can see that. Give me a thumbs up, Ollie.
You
Sweet,
got it.
excellent.
You're good.
Excellent. So I'm just going to dive right in. And sometimes this might seem obvious, and sometimes this is not obvious to folks. And that is that America is aging. What I mean by that is that the percentage of people that live in the United States that are over the age of 65, that percentage is growing. Where you can imagine 1 in 4 Americans by the year 2030 are going to be, in 2060, are going to be over the age of 65. And why that's important is because there's things that change in our body. And one of those things is that we have an increased risk of falls. And if we look at the data over the last probably about 30, 40 years, a real conservative estimate is that falls impact to a point where it can cause disability or even worse in 1 in every 4 older adults. So if you can imagine, by 2030, we're going to have 73 million older adults, and of those, 52 million will have had a fall in a year's time. That is some huge numbers. Now, of course, there's two sides of that. Like, one is, what are things that we could be doing as in our own lives and as a healthcare system to help hopefully reduce that risk of falls, help to prevent that. But also thinking about that, like, if 52 million people are having falls each year, how that in turn impacts, again, our ability to serve those people in our healthcare system as it is today. So that's just sort of like, I shared this slide because it kind of just accents the sort of the importance of this as an issue and something that we need to pay attention to as a healthcare community, and also just as a society in our own communities and amongst ourselves. Now, when we look at falling in any one year, about 30% of older adults have a fall each year. 30% have a fall each year. Now, if we look at more of our region, we look at California, we say, how many people actually fall more than once in a single year's time? Now, California, the average in 2007 was around a little less than 15%. So 15% of older adults in California were falling more than once in a year. But when we looked at the rural communities and counties of Humboldt, Mendocino, Trinity, and Del Norte, what you'll notice is that that percentage is higher. Particularly Humboldt, as high as 18% of older adults in 2007 were falling more than once than the rest of California. And that raised a question at that time for myself and Sarah, which was like, okay, older adults living in these rural counties of California are falling, but why? Why are they falling more so than the rest of California? And this brings up two really key important topics when it comes to falls, and that is risk factors. And one type of risk factor is what we call extrinsic risk factors. I like to think of extrinsic, the E, as meaning external to you, and intrinsic are those more internal factors. And we'll talk briefly about what those are. So when we look at risk factors, a risk factor is anything that is a characteristic of a person or a situation that might be associated with more falls or having more falls than some other variable. And so things that are considered intrinsic risk factors are, one, just the demographics of the people. Different types of people tend to have more falls. So demographics might mean if you come from a lower socioeconomic community, typically sometimes if in an urban setting, people in those neighborhoods that have less ability to access healthcare, they'll have more risk of fall. So that tends to be our Black and Hispanic communities in our urban centers. That's an example. Just having a prior history of falls actually is an indicator that you're more at risk of falls. But medication, any kind of chronic conditions that you might have, diabetes is another example of something that's intrinsic to you. People with diabetes tend to have more neuropathies. Increased neuropathies put you at an increased risk of falls. We even have identified that having a fear of falling actually puts you more at risk for future falls. So those are all, again, intrinsic, internal. Balance is another one. The way that your balance is, as you can imagine, if your vestibular system or your vision is deteriorating, that can put you at an increased risk of falls. We have behavioral sides of people that's also kind of intrinsic, and that is something though that is you can change. Behavioral is to what level do you get physical activity? Are you physically inactive most of your life, or do you go out and do a walk every day? Do you go out and do yoga or Pilates or Tai Chi? Those are all behavioral factors that are somewhat associated as being intrinsic to you and can certainly impact things like muscle strength and balance. Then also whether or not you're like a rusher, or you're what you pay attention to. Do you pay attention to your surroundings in depthly, or do you just kind of move loosely through the world and maybe might trip over things more often? Now, extrinsic risk factors are things that are external to you. And the classic example might be like your footwear that you choose to put on that day, right? You might put on, if you're putting on, let's say, really slippery shoes, like dress shoes that have a slippery surface on the bottom, and you're walking around in Humboldt on a wet day on fresh cement. Well, you just put on something that's going to put you at more risk for falls. Other really, probably some of the biggest factors are things in your own homes that we call home hazards. And we pretty much all have them, but to just different extents. And that could be the lighting. It could be literally your pets. It could be the rugs that you have in your room, carpets, things of that nature, clutter, non-clutter, furniture. All of that can be, whether or not you have hand railings, are what we call extrinsic risk factors. Now, I'm bringing this all up because the question I want to remind you of was like, what is it about rural older adults here in Humboldt, Trinity, Del Norte County that's putting us at a higher risk of falls than the rest of California? Is it extrinsic? Is it intrinsic? What is it? So one of those pieces, right, in that intrinsic risk factors that I talked about is balance in your overall mobility. And things that impact balance and mobility are vision, which is probably, if you've ever closed your eyes while trying to walk, you start stumbling around as if you were drunk. We also have sensory receptors within our body, which we call proprioceptors, and they sense movement from within your own body. And as we get older, those nerve endings and those receptors start to die off. So you often have less of that sensation. That could be the sensation under your feet or in your joints, etc. We tend to have slower reflexes when we get older as well. Muscle strength tends to decline also when we get older. But I want to point out that muscle strength is something that you can build strength even as you get older, and you can improve even your balance as you get older. So these are all factors that are internal to our bodies that affect balance and mobility, which in turn affects your risk of falls. So this led to, all of this is again the background or the underlying sort of questions and or possible explanations for why older adults living in rural communities might fall more often. And at this point, Sarah and I did a study about a decade ago now, but this still holds true, that explored why older adults in rural communities might be falling more often. And at this point, I'm going to transition over to Sarah and let her tell you all about this amazing research that she was the lead on before she became her physical therapy self.
Go ahead. Yeah, will you switch the slide, Justis?
Yes.
Because I don't think I have access to that. Yeah, so it was so fun. So he says before I was the physical therapy self, but I feel like it was totally ingrained in there all the time. And it's so fun because all of this stuff comes up all of the time in physical therapy, right? I talk about it with the students that I'm teaching here on campus. I talk about it with my patients in the clinic. I mean, let's be real. If you run into me at the co-op, I'll be talking about it there as well. Like that's just, it becomes part of who you are. So what we did over a decade ago now is we got 107 older adults and we put them into different categories. What we were really looking to kind of compare was what we call rural community dwellers versus urban. And to kind of define that, there's basically 3 different areas that are considered. It's called urban cluster. So we're not like the San Francisco, but we still have enough of a population, and that's where those numbers are right there. So that's going to be Arcata, Fortuna, Eureka, and McKinleyville are kind of where there's a little bit more of a hub. However, we were able to go out and look to all of these other rural communities as well. So in the end, we got 52 rural dwelling community members and 55 urban dwelling community members. And what we really looked at is we looked at structured exercise classes. So one in particular, hopefully you guys have all taken this, and if not, you should. The SAIL program is an absolutely amazing program from Area 1 Agency on Aging. And it used to be a little bit more prolific. There used to be different places where you could take it all over Humboldt and Del Norte counties. Now I think there's still a couple classes left. I know McKinleyville, Eureka Senior Resource Center has one, and down in Fortuna as well. A great resource working on strength and mobility and stability, of course. So we looked at those structured exercisers. So we went to all of the different classes and we were able to test these different participants. Then we looked at participants who were unstructured. So unstructured means that they were still getting exercise. They were still out doing something, but it just wasn't in necessarily a class. So that could have been just, you're lifting weights in your garage, or you're going for your hike with your buddies. You're doing some kind of exercise, but just not with an instructor. And then we looked at those who don't participate in any exercise. And we got to compare a bunch of different factors. Justis. So there was a couple different things we looked at. One was just a fall history questionnaire. As Justis said previously, your fear of falling and how much you have previously fallen also can be intrinsic risk factors in the rate of falls. So we definitely wanted to have a better understanding of what was going on with that history of falls. We also looked at the physical activity scale for elderly. How much are you participating in? What different activities are you doing on a regular basis? And, how often and frequent are you doing those different things? Then we looked at mobility testing. So these kind of tests are part of our current fall risk assessments that we do. We have one that we do through the OLLI program that we pretty much do once a semester. So if you have any interest in getting tested, join up. However, we also can just invite you to the lab on campus and run you through these tests and a couple more to really have an understanding of what's going on with your balance. But one of them is the 3-meter timed up and go. So what you do is you stay in a chair, you stand up, you walk 3 meters, and then come back and sit down. It's a great test. So you're looking at lower limb strength. You're looking at the ability to turn that corner. So that's looking a little bit at that vestibular system, as well as your accuracy and how well you're able to perform that. And then you come back and sit down. So that's also looking at lower extremity strength. Then preferred walking speed. Preferred walking speed is just a great test in general. This one, I do it while I'm walking through the airport, right? We're just always looking at how different people are moving. It's so important. And one of the things is how fast are you walking? So what the research has really told us in regards to this is how safely and quickly you walk is kind of a determinant in longevity. So these are some of the tests that we really look at. And then, of course, chair stand. So how many of you just perform chair stance? We sit down and then we stand up and then we sit back down again and then we stand back up again, right? What a great way to work on some of that lower extremity strength. So these are a couple of the mobility tests that we did out in the community. And then we also looked at balance. So two different things, right? Our balance test, how well are you able to stand on one leg? And is one leg different than the other? Again, these are very important in just understanding kind of what's going on with your balance. I always like to do it at the kitchen counter so that there's a little bit of stability. I test myself while I'm brushing my teeth every morning. How is my single leg balance? And then we look at modified clinical test for sensory integration and balance, the modified CTSIB. And that's really looking at integrating the different sensory systems. So the way that we balance, we use our vision to balance, to understand. We use our vestibular system to really understand where the horizon is and how. So if our horizon's like this, then our whole body is shifted, right? We're always trying to look to find that. And then, of course, proprioception. And Justis kind of touched on that when he was talking about especially people with neuropathy, most commonly seen in patients with diabetes. And proprioception really is our ability to tell where our body is at in space. So super important test to just have a better understanding. So go ahead, Justis. So we went to all of these different places, all throughout Humboldt and Del Norte counties, as far out as, we did Rio Del, we went out to Hoopa, we went, you name it. We were all over the place. So it was really fun getting to take this fabulous research team of students and get to go out and really have interaction with the public, right? And really getting to give back a little bit, and hopefully people are understanding a little bit more about where they stand with it all. So again, we have our different categories. We have our structured exercisers, we have our unstructured exercisers, and we have our non-exercisers. And then we broke them into that urban or rural dwelling. So we have our mean ages, how much they're actually exercising per week. So actual minutes of exercise, and then their physical activity score. So that's that PASE, is that rural versus urban. And what we're looking at, Justis just highlighted it, which is perfect, is we're looking at how much people are actually exercising and what those scores mean. And what you're seeing here in yellow is there's a pretty consistent number in the structured and unstructured exercisers. There's a little bit of variation there, but look at those rural dwelling non-exercisers, right? That number is actually pretty high. So how much are those rural non-exercisers actually participating in a similar amount of physical activity as compared to the urban and rural exercisers? So why might that be, right? All of these people who are not participating in structured exercise, but living in rural communities. So some of you might be, right, living in rural communities and are technically exercisers, but what's going on in that? So let's switch that slide. So what we looked at is older adults who fell in the past year, right? So these are all of the different things. So that blue is the structured exercisers, the red unstructured exercisers, and then of course the green are the non-exercisers. And what we found, there were significant differences between the structured and unstructured exercisers. So our rural older adults fall twice as often. You can kind of see where that number, how it looks right there. So again, rural community dwellers who are unstructured exercisers and non-exercisers are falling twice as often as our urban counterparts. Let's just pause. Like that's pretty amazing to kind of take a look at. So if nothing else, right, structured exercise. Yes, we totally love our structured exercise program. We are going to push that all the way. But why are so many people also, why are unstructured exercisers and are in rural communities and non-exercisers falling so much? Let's just think about some of those risk factors, right? And I know we'll dive into this in a little bit more, but think about curbs. Think about how long it takes to go get your mail, right? Down that deep, steep dirt road, a mile just to get your mail. How many people are relying on wood heat and have to go chop the firewood, right? So all of these different factors. I mean, I live technically in rural and I still have to carry in my water jugs, right? Those are increased risk factors for falls. So just different environmental things that can really look. Yeah, SAIL also offers classes via Zoom. Let's go, right? So that's where you can still be part of structured exercise and live in rural environments, which is so awesome.
I just want to highlight one small thing that you're pointing out that I think is such a critical thing that comes up between what the last slide that we just showed you and this slide. And that is that when you really look at the people that live out there in those real rural areas, they're getting lots of physical activity, right? They may not be, quote, exercising in a class or something, but they're getting tons of physical activity, as much, if not even more, than people participating in classes who live in town, so to speak. But even with that physical activity, they're still falling at much higher rates than those that are living in more urban communities. So it's really sort of an interesting juxtaposition, and we'll explore a little bit more as to why.
So this one is really looking at that living location. So older adults who fell more than once in the past year. Again, we're looking at our urban community versus our rural community, and it's the same colored. So the blue is that structured exercisers, the red are unstructured exercisers, and the green, those non-exercisers. So what I love about this graph is the California average. You see that California average of how many people are falling. Well, look at our urban and rural structured exercisers. We're below the California average, right? So again, we can't help but push. Let's get involved in some structured exercise because it's so important. We're looking then at the red, which is our unstructured exercisers in urban and rural communities. Again, we're above that average, and our non-exercisers are that much more. So more than 40% of the non-exercisers fell more than once a year. That's huge. That's huge. And just has such an impact on their health, their caregivers, right? Where they're at, but also our medical system. And all of the different things that entails. So less than 12 of the structured exercisers fell more than once, less than the California average. So again, big highlights, great kudos for those participating in those structured exercise classes. So really what we took away from this really fun study that I kind of want to do again, like maybe we do it again and get more data because we love data. So our main conclusions, it was really the effect of the living location. So our rural older adults fall more often than our urban older adults. Similar levels of mobility and balance. And I think that's such a huge takeaway. Their scores were not that different, right, than our structured exercise participants. However, they're falling more. And again, it goes back to my father-in-law. He lives out a little bit, and his name is Bill. We call him Billy, and he calls it Billy Sport. Instead of health sport, it's Billy Sport. And he goes out and he chops wood and he's lifting hay bales and he's moving bags of tools and different things like that. It's those kind of everyday, what we call functional activities that are super important. We have a question in the chat. Examples of unstructured exercise. So like we said, we have the three different categories. So structured exercise, like the SAIL. We have the unstructured exercise. So that's, like I said, like lifting weights at home. So it's what we would quote unquote think of like an exercise program. You're going for a hike in the forest or at the marsh or around. You're lifting you do your weight program, but you don't have an instructor that's guiding you with that. Does that make sense of an unstructured exercise? If not, let us know. But going back, so again, the effects of exercise are just so important. So especially among those urban older adults, those exercisers fall tremendously less and have better mobility and balance than the urban non-exercisers. So even in the if you're just looking at that urban community, the structured exercisers are having less falls, right? Among those rural older adults, the structured exercisers, yes, are still falling less than the non-exercisers, but the only structured exercisers have better mobility and balance than the non-exercisers. So super important to think about these extrinsic factors and what an important role they play in fall risk among especially the rural dwelling older adults, but also thinking about the urban dwelling adults as well. And something as simple as the ground that they're constantly walking on. And I laugh because some of, even in our urban dwelling community, some of our paved roads have some bumps and potholes and different things like that, right? But there's just more structured areas and not as many things in the middle of the roads, of the sidewalks. There's not as many tripping hazards, right? As compared to our rural communities, where some of these fabulous, even community centers in these rural environments, you know, there's steps, 5 steps to enter, and they're not always wheelchair friendly or walker friendly or different things like that. One fabulous place down in southern Humboldt, there was just big rocks to sit on and around instead of seats, right? So that's going to really affect sitting down on a rock that might be a little bit unstable. It's going to be a lot harder than maybe a chair at a standard height. So big different factors in our rural and urban community dwelling adults.
One thing that you can really take away from this, I mean, because this is sort of, we're breaking things up to gain understanding. But what we're not saying is, we're not saying everybody who lives out in a rural place and is out in Bridgeville, or everyone needs to move to town to reduce the risk of falls. That's not what we're saying, right? What it's recognizing is really the same factors influence falls, whether or not you live in town or you live out of town, and whether or not you have access to structured exercise classes or not. If you put this all together and you want to reduce, no matter where you live, no matter what you have access to, if you want to reduce your risk of falls, is you make sure you pay attention to your environment and try to reduce those risk factors. If you have low lighting in your house, get better lighting. If you don't have any handrails, see if you can get somebody to put in handrails for you. Try to reduce those extrinsic hazards or your exposure to them. Like if you like working in the garden, try not to do it at dusk or first thing in the morning when the lighting is bad, things like that. But at the same time, you have this opportunity, whether it's through structured exercise or unstructured exercise, or just being physically active in the garden, around the house. All of that contributes to building strength in supporting your balance and your overall mobility. And the better your balance is, the more mobile you are, and the better your strength is in your body, whether it's due to structured exercise, unstructured exercise, or just being physically active. All of that will help to reduce your risk of falls. And that's something anybody can do anywhere at just about any time. Those two things: reduce your risks that are out that you have no control over, and reduce your risk by keeping yourself mobile and active as much as you can, with given whatever your circumstances are. Because a lot of us, we have different things going on in our body that sometimes inhibit our ability to be that way. But I think that, to me, is a very important overall take home from this work that Sarah and I did back then that is still relevant to this day.
So there's a question in the chat.
Yeah.
Or did someone else have a question?
No, the chat is, can you please give some examples of unstructured exercises?
Yeah, so in the chat, what I'm reading is why does having a structured class versus just exercising at a gym, elliptical machines and lifting weights on own make such a difference?
So Sarah, do you want to answer this or want?
Either way.
Yeah, we'll tag team.
Yeah.
So there was some recent research that was done. Well, I should say recent. It's recent to me, but in the sense that like in the last 10 years, a lot of the structured exercise that is there specifically for older adults, which is really the courses that we measured here, are specifically designed to address essentially falls, and they're designed for strength, balance, and mobility in a way that supports and reduces the risk of falls. A lot of unstructured exercise is kind of like I'm going to the gym, I'm lifting weights, or I get on an elliptical, or I do some water aerobics on my own, or whatever, or I'm just going to go for a walk. And sometimes what happens is there's less time. You're not doing it as many days of the week. It's not as specific to the muscles that you need for balance and mobility. It's not as focused in that particular area. That's just a series of studies that have been done to sort of help explain in part why one you tend to get better results than the other.
And there's a social component to that as well. You kind of push, some people tend to push each other a little bit more when they're in a social environment. Plus, it leads to there's some really cool research about group social classes and the effects of falls and aging. It's very interesting. They're trying to kind of figure out a little bit more about why that is, but I mean, everything's connected, right? So just the differences with that kind of thing. So does that answer your question, Sharon? Hopefully, if not, let us know. And then we have Jenny. Do SAIL classes work on Zoom as well as on-site classes? In-person classes are not easy to find. Yes, 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 yes. Zoom it up. Again, what the cool part about SAIL and Matter of Balance and all of these other different kinds of exercise classes is they're so research-based, tested for a gazillion different populations, actually all over the world. And so this is very specific to fall risk specifically. So like Justis said, they're working on specific muscle training and balance training and sensory training to help decrease risk of falls. And doing them via Zoom is a great alternative.
So one of the things that emerged from this study was a realization that in talking with a bunch of our community partners, outside of Cal Poly Humboldt, Area 1 Agency on Aging, Public Health Department, United Indian Health Providence, IPA, you name it. A bunch of folks were doing things to try to address falls in our community, but we weren't really communicating very well with one another. And so one of the things I really wanted to do was to bring together all the people that are working on fall prevention in Humboldt and Del Norte County and Trinity County, and bring folks together to start having conversations about, hey, what are we doing and how might we work together collectively and strategically to support older adults in our community. So we had essentially a summit, a big meeting, and this was probably literally like 2 months before COVID hit. It was like the timing was in a sort of bizarre moment. And again, we were trying to understand what we were doing. And what came out of that meeting or that summit was for us to work together and one, to get better data, more comprehensive, more than what Sarah and I had already done about what is going on with falls and or fall prevention efforts, and what do our communities want in terms of fall prevention programming. And so from there, I worked with another master's student at Cal Poly Humboldt, and we worked with public health and Area 1 Agency on Aging and a few of our other partners, the rural, the Humboldt Senior Resource Center, and others, United Indian Health, and we designed a study together. And the study was to just get a sort of a snapshot of who are our older adults, understand their demographics, everything from age, gender, their medical history, their history of falls, to understanding and looking at some of the risk factors that they're exposed to, similar to the ones that we measured, that Sarah and I measured. And then we also looked at whether or not any of them were participating in exercise classes or some other fall prevention course. And then and for me, the biggest piece is the last one here, was really trying to get at what are you interested in participating in? Because different people in different areas have different interests. Not everybody maybe wants to be in a group class. Maybe they just want to go on a walk with friends or something like that. So we designed this study. We implemented it it was about a little over a year in Humboldt and Del Norte County, and we distributed this to folks who are over the age 60 years and older, whether they were community dwelling, meaning like they live in a home or apartment on their own, or also if they were in some type of housing facility that's like a group home or a senior nursing facility, things like that. And we tried to do this in, what I call the Humboldt Bay Area, Crescent City, but we also went as far out as we possibly could get to folks. All the way out Bridgeville, Southern Humboldt, Whitethorn, out to, geez, you name it, we went there. And we did this, we distributed it in a whole variety of ways. We advertised this on the radio, we put it in the newspaper, flyers up, and we did pretty well. We even did bulk direct mailing to communities that we knew had a very high percentage of older adults. So we try to do our due diligence in getting it out there. It's no longer open, so you can ignore the QR code if you're trying to scan it. You might be able to still look at what was in it, but we're not collecting data anymore. And we collected data over about a 7-month to 1-year period of time. And then we got all this data, and sure, we analyzed it statistically to figure out where there are differences, but we did something very unique. We actually mapped it. We looked at maps of where people were living, and we mapped where the incidence of falls were greatest in Humboldt and Del Norte County, and also mapping where people had interest in different types of fall prevention work. So we looked at things like people who are fallers versus non-fallers. And what we mean by fallers is typically if you're falling once or more in the year prior, you're identified as a faller. It also could be based on risk factors. If you have a high number of fall risk factors, you could be identified as a faller. Typically, they also fall more than once. And again, we did that typical where we also looked at differences between people living way out in these very, very rural parts of Humboldt and Del Norte County versus those that are living in town. And so an insane amount of data. We'll give you all of these slides. So if you want to poke around and look at this data, you certainly can. This is like all about the demographics. You can see we looked at age and gender, ethnicity, race, educational background. And what we found was, and this is very typical in falls, and particularly here in Humboldt, is that the majority of people that participated were women. Women tend to participate in pretty much all things fall prevention, more so than men. And that's its own concern of mine. Majority were non-Hispanic. So we struggled actually getting into the more Hispanic communities down in the Lolita area and Fortuna, where we tend to have a higher Hispanic population. There's more reticence to getting involved in research in those communities. And the majority had some level of college experience. So that's it kind of like gives you some basics. So mostly women, mostly vast majority non-Hispanic, and the vast majority were Caucasian. So that just tells you who was sort of answering our survey, which is not surprising in these kind of surveys in communities. They tend to be the people who have some of the most resources. So let's look at actual fall risk here. And so one of the ways that we look at fall risk is there's some surveys that we can implement. There's 3 different surveys that are known to show whether somebody is at a high risk of falls. One of them is called the 3 key questions, or the 3 key cues. And this is basically, one of them is like, have you fallen in the last year? Another one is used nationally called the Mach 10. Some clinicians will implement that or some version of that in when you go see your doctor. They'll often ask these questions of them. And basically, my point here is that it's showing what percentage of the people that we interviewed in Humboldt, of the 615, 85% using the 3 key Q questions, and at the lowest, 55% using the steady 12, were at risk. So half the people that we surveyed in Humboldt County, more than half, were considered to be at risk, at a higher risk for falls than what is normal. That's a lot. That's a high percentage. If we look at the breakdown between rural and urban in Humboldt County, shown in the 2nd and 3rd columns, we see that essentially similar levels between the two, nothing terribly dramatic. We see between the different surveys. We saw that the urban appeared to be at a slightly higher at risk than our rural, which is surprising given the results of the prior study that we did, which showed that our rural adults were, in terms of number of falls, showed a higher risk. So there's something that we needed to do in terms of follow-up from this study, that we need to explore why, according to these surveys, they would be considered higher risk. When we look at Del Norte County, we see similar numbers. We see very high percentages, anywhere from over 50% to as much using the 3 Q questions. 80% of older adults are considered to be at a higher risk of falls. And similarly, we see that fall risk appears to be, according to a couple of these surveys, a little bit higher in the urban communities, but it was not enough to be statistically different than our rural communities. So basically, we're here in these rural counties of Humboldt and Del Norte, we're at a high risk for falls. That's the bottom line of what I would take away from this. When we look at the history of falls, like the history of falls doesn't mean like ancient history. This means like, did you fall in the last year? The number of falls that you had in the last year. And what we found out was that 40 to 48% of the folks that we surveyed had had a fall in the year prior to when we took their survey. That's a very, very high number. And 65% to 95% of folks had some type of injury as a result of that fall. Very interesting. We can dig into more of the types of injuries, which you'll see down here. But of those, at the same time, we found out that about 40 to 50% as a result of those injuries required some type of medical service. So if you think about it, about a quarter of the people that we surveyed had a fall and had to get medical attention as a result of that fall. 50% of the people we surveyed had falls in the prior year, and half of those had to get medical attention. So you can really see like the impact on people's lives that you can see. If you look at the types of injuries, typical types of injuries that occur are cuts and abrasions, things of that nature. You'll see that head and brain type of injuries appears to be low. We talked about concussions, but that typically goes underreported. The typical expected average percentage of people who are older adults who fall, particularly if they hit their head, you're looking at close to about 25% might have some type of head injury that they're not even aware of. So if you know somebody, or if yourself have a fall and you feel like you're having headaches or woozy, or you start to vomit, or you should suspect and you should seek medical attention to see whether or not you have a concussion of some type. That's probably one of the ones that we see most underreported in older adults. Here. And in Del Norte County, we saw one of the things that we thought was interesting that between 11 to 14% of those folks had to go to the ER after their falls.
So Justice, Nancy has a question.
Yeah.
I have a concern. I had one fall last year and I'm 86. The reason I fell was I was in the middle of a 2-week illness with flu and croup and
yeah.
antibiotics. Why do I have to put myself in that category of one fall? Didn't hurt me. I was up and about, but it strictly was because I was in an illness situation.
Yeah, that's a real, Nancy, you bring up an incredibly important point. And this is like understanding the context, right? So in your case, it wasn't like something that like, you know, your body was debilitated from years of not using it and
Right.
doing all these. It was like, it was associated with the fact that you were essentially you know, had an illness at the time that it occurred. And I'm sure that contributed to that, to your fall. And so, yeah, technically when you're doing these broad, you know, large surveys, right? Stuff like that doesn't get teased out enough. And I think it's more important that if you have a fall, that's when you talk with, whether it's like your fall, Nancy, or somebody else, when you're having conversations and somebody's asking you about that, like a physician, that you give them that full context, because they might just like label you a faller and you're like, no, I actually exercise. I go out and I walk in the community forest 4 days a week. And, you know, I go in the, you know, you do all this other stuff and it doesn't have the context to it. Whereas somebody else, they may not fall at all, but they're completely inactive. They have, their house is full of hazards, where they're probably a bigger concern, even though they didn't fall,
Right.
for fall risk than perhaps you are, Nancy. And I think that kind of conversation and having those conversations with your physicians and or even your friends, and making sure people understand context matters in these things.
Thank
So
you.
that's a really good point, Nancy.
And it's something to think about for the larger numbers that we get as well, is we're not getting a lot of the context on a lot of these different things. So from you know, national and international level, context really does matter.
Yeah, absolutely. So one of the things we also did was when we looked at falls, we kind of wanted to know like where falls were occurring. And we broke this down into lots of detail, like outdoors, indoors, parking lots, sidewalks, stairways, things of that nature. And we did find that something that was interesting is that we had a significantly higher number of falls that were occurring outdoors. Go figure, here in Humboldt and Del Norte County with our active community. But we also found that in terms of time of when people were falling, the majority of falls happen in the morning or essentially afternoons. So when light is typically at low levels. And so we always talk about this in our fall prevention classes that we hold at the University for Older Adults. But when you are in low light situations, dawn and dusk, when the shadows can hide roots that you're where you're walking or the edge of a sidewalk, things like that, that is when you are typically most at risk in those particular situations. And we found that it accounted for about 75% of our falls occurred during those particular times. When we looked at the folks that factors against some of these intrinsic risk factors, one of the risk factors that we talked about earlier was something called fear of falling. This is just like, I'm worried about falling. And what we find is that that actually puts you more at risk. And when we assess that, we found that 70–80% of all our respondents, so, you know, looking at almost 800 people, 70–80% of those folks have some fear of falling. And having a fear of falling can impact your decisions about whether or not you're going to go on a walk. It's going to impact your decision about whether or not, you know, where you whether or not you're going to go out and be social. So fear of falling, we're discovering, can have both not only physical implications like increasing your risk of falls, but it also has what we call socio behavioral implications in affecting depression and your ability, happiness. So there are classes that actually address fear of falling so that you can essentially build confidence and reduce that fear of falling, along with actually reducing and improving strength and mobility in your bodies. We also found out that about 70 to 80% of the people that participated in our survey had some type of chronic condition. This might be everything from heart disease to diabetes, neuropathy, some type of chronic condition that had been occurred and had been occurring for several years, impacting. And chronic conditions are one of those intrinsic risk factors that can greatly impact some more than others. But and like I mentioned, diabetes is a classic example of a chronic condition that greatly increases your risk of falls. That's an example. Neuropathy is associated, but also considered a risk factor, chronic condition that can greatly increase your risk of falls. When we looked at medications, 80% or more of the seniors were taking prescriptions, on average 4 to 5 different medications. And of those folks, about between 9 and 16% were taking a medication that was a sleep medication. And that's important to us because sleep medications often increase your risk of falls, and so do mood medications. So if you're taking medications for depression, anxiety, or sleep-related medications, those can also increase your risk of fall. So we look at this, quite a few folks were taking medications, and quite a few were taking medications that are known to increase the risk of falls. This again, we are looking at medications that impact balance here. And we asked whether or not they've been talking with their physicians and or pharmacists about their medications, and whether or not that's something, if you know somebody or yourself are taking medications, talk to your pharmacist, talk to your doctor about what they know about how those medications may or may not influence or affect or increase your risk of falling. The other thing that we're always interested in is your homes, and whether or not how your home is set up, and does your home in its own right, the way it's set up, increase your risk of falls. And what we found out was the vast majority of folks were not having conversations with their doctors about their medications, and had not had any kind of assessment of their homes for falls. And the reason why we ask this is it shows that our community needs that. We need to have better conversations with our doctors about, so they are proactively having those conversations with their patients. And we also need to work with our community partners to try to provide and create and maybe go after grants that could provide home inspections for our older adults in our community. So these are just some things that we're realizing, that we need to have more conversations with healthcare workers, and we need to try to provide better assessments for our seniors, so they understand what the risks are in their homes and what they can do about them. We looked at physical activity. We found that in Del Norte County, 30% of people living in Del Norte did not participate in pretty much any physical activity, whether it's structured, unstructured, or just getting out. So kind of high. And that we found that, of course, as you might expect, those who are fallers had considerably less physically active than those who are non-fallers. So it's great if you're physically active. That in its own right is helping to reduce your risk of falls. We did find out that approximately between 40 to 60% of our participants were participating in some type of local exercise class. We do think that this data might be somewhat skewed because, as I recall, part of the way that we distributed this survey was through our community partners. And in many ways, they were doing that through their like email lists and their phone lists, which are typically the people who participate in their programs. So probably realistically across the two counties, the number of folks participating in exercise classes is considerably lower than 40 to 60. So I say that with a grain of salt. Getting into a lot of different things. One of the things I told you that we were interested in was trying to understand what are people wanting to do about fall prevention? What kind of classes would they be interested in? And some really stood out. And those are showing up here in the bottom in green, this green box. Tai Chi is it's probably one of the exercises best known to reduce the risk of falls. There is a high interest in that. Another one was, it says AMOB, that stands for A Matter of Balance. That is an exercise class, but also addresses fear of falling. Another one is Staying Active and Independent for Life, known as the SAIL class. All three of these were considered our top three: walking groups and hiking groups. Those were the ones that really stood out in terms of classes that we could be expanding our implementation across the two counties. So that's a next phase of where we can go with some of this. It was interesting to look at how people want to receive information. Some of this was the two that really stood out is just having good information available through the internet as people poke around, whether it's through some of these agencies. And the other is through private conversations with their healthcare providers. Those are the ones that really sort of stood out. We looked at this stuff, like I pointed out, using GIS mapping. This shows a map of Humboldt County and where people were interested in participating in different classes. And we found that, depending on where you live, you might have different interests. And the reason why we did this was so that our different local agencies like area agency or public health, if they're looking at, where might we start a SAIL class? Where might we start a Matter of Balance class? Where might we start a walking club? That we might get some better ideas of what we might do in these different communities. So I'm gonna kind of just move through these. This is showing Humboldt or Del Norte County. Del Norte County was really interested in Tai Chi and the Staying Active in Lending. Those were by far the most popular in Del Norte, and there was a need for that up there. When we talked about what are barriers to accessing fall prevention classes, the biggest one that really stood out was just being far away, distance, geographic location. When you live out in Bridgeville and there's nothing out there, having to go all the way into town to Eureka for an exercise class represents a barrier. So we are trying to brainstorm different ways where somebody might be able to participate in classes in these more rural, geographically isolated regions of our two counties. So from this is the next steps. And this is where it gets really sort of exciting. And I'm going to kind of tag team me and Sarah here. One of the things that we're post-COVID, it's time to reconvene the Fall Prevention Summit and get people together again and working in the same direction. We have an abundance of data here that is perfect for writing grants. The grant environment from the federal level has become a little bit not great. Let's just say that. There's fewer grants available through federal agencies, but on the bright side, there's more grants available through our state and some of our regional partners. So that's something what we need to do. We need to work together collaboratively across different agencies to write grants that support fall prevention in our communities here on the North Coast. So that's something we need to do. We need to get everybody back together and working in the same direction. At Cal Poly Humboldt, something that is within our control, Sarah and I have been working with students in a variety of programs. And something that a lot of folks don't know about becoming a Cal Poly is that this whole second phase of becoming a Cal Poly has been focused on health-related programming. And so this year, we just launched 2 new degree programs. One is a health and medical sciences degree, which is aimed at people going into careers in medicine. So MDs, physician's assistants, pre-pharmacy, pre-clinical lab scientists, and pre-physical therapy are the focus of that. We also just launched a community health degree program, which is aimed at health navigation and health advocacy, career paths that help people in our community navigate the healthcare system, which, if you've experienced it, is a very challenging system to navigate. But with all of these new degrees and our existing degrees, we're building out what we call clinical practicum internship experiences. So we want our students going out and engaging with our community, supporting the health and well-being of our community by going out and participating in different programs. And so one way that we do this, Sarah and I continue to lead the fall prevention program, where we go out and we train these students on how to do fall risk assessments out in the community. So we'll be coming to a senior center near you, or you can be coming to us here on campus. But we offer year-round fall risk assessments for the community. We do it through OLLI, we do it outside of OLLI, but it's something that we've always wanted to be available. And that we do is we train these students that are going into these health professions on how to do that. And we assess your balance, your mobility, all these risk factors, but we give you strategies for reducing that risk of falls and different fall prevention things that you can do either at home or a class that you can go to hopefully reduce that risk. The other thing that's coming up where we're excited about, right across the street from Arcata High School, is going to be the new location of our health education hub. This is going to be the home of our nursing program, our concurrent enrollment nursing program, where we partner with CR under the great leadership of Eden Donahue, who leads our nursing program in the School of Applied Health. It'll also be places where our students, whether it's in applied health, health and medical sciences, fall prevention, where they can come together and work collaboratively, and where we can hold classes for the community in this space. So it might be a class on fall prevention, but you might also find a class on how do you navigate neuropathy. It could be about pelvic floor health, something that Sarah is amazing expert at. So this new health education hub is not just a place for academic programs at Cal Poly Humboldt and at CR, but it's a place where our students and the community can come together and overall learn from each other and overall to help improve the health of our community. It will be the home of our new Center for Healthy Aging, which is essentially a home of our fall prevention programs, where we'll be able to offer classes to the community, not only here locally in person, but if you can't make it, we're going to be able to stream it through the internet to you in things like Zoom, where you can participate in an exercise class, a structured exercise class from the comfort of your own living room. These are just some of the things that we're doing at Cal Poly Humboldt to better engage with our community. So with that said, I'm just going to say thank you on behalf of myself. Thank you, Sarah, for all the work that you've done and continuing this work. Thank you, Jane, and the folks at OLLI for giving us this time to spend with you and share the work that we've done over the last decade or so. And if you have any questions, yeah.
Yeah, so I'm gonna start working through the chat a little bit.
Okay.
As always, so Justis was my teacher back in the day, and I just could learn everything from him. I'm like, you're a great teacher. I wish you were teaching more. That's what we need. We need more Justis teaching time. Okay, so a couple comments and questions from Carrie. I think that being distracted with life situations caused my last fall. Also a fender bender and acting spontaneously without preparing my movement. And that's where a lot of people, you practice not falling, but you practice reactivity, right? So something as simple as catching a ball, right? Reacting to an environment, reacting to different situations, and reacting to some of that fall risk. And that's where a lot of those structured exercise classes actually are able to incorporate some of that stuff into it. Also, just promoting physical therapists, but they can do that also, and they should be doing that, especially if you're a fall risk. They can help you with those different kind of activities. Okay, next question. Yeah.
Hold on. I'm going to add one thing, and I think this is sort of what I mean. I've heard her say this a number of times, and I just really love it. And I think it's be mindful, right? You know, we always talk about mindfulness, you know, and being mindful in your movements about what you're doing. It's really easy for us to be thinking about the next thing, or to be thinking or worrying about perhaps, you know, your kids or your grandkids while you're doing something around. But the more you're able to be present with your own movements and what you're doing, that alone will help to reduce your chances of a fall. One of the places that we see a lot of falls is when people are talking on their cell phones and walking and not being mindful of their environment while they're doing that. They walk right off a curb and they fall. Like that is a very common, or they walking up a curb and they fall. So I can't emphasize enough that idea of being present with yourself in your movements is going to alone really, really help you. And it's hard to do. I mean, I struggle with that all the time. I sometimes I walk across campus and I don't even know how I did it because the whole time I was thinking about something else, right? That's not me being mindful. And I need to do that myself because I have tripped. And, you know, it happens. It happens to everybody. So that's something I can't emphasize enough. Be mindful with yourself.
Yeah, and sometimes what that means is resetting. So stopping what you're doing and taking that deep breath, like deep diaphragmatic breath, to be like, okay, all right, be present in the situation, be present in the moment. So I absolutely love, love, love that. Did you consider, is this the next one? Yes. Did you consider rural is far more active than urban, who may not get out of their homes as often? And what point when you notice your balance isn't as great should you schedule a doctor's appointment? So that's exactly what we noticed, is that our rural dwelling folks, their test scores in terms of strength and mobility and were high. That wasn't the issue. The issue was not that they weren't as active. The issue is that they were probably more active. They just have more risk factors living in a rural environment. And honestly, those are the functional activities that I promote. Those are the things that I think are so, so, so important. But again, it comes back to being mindful of, okay, there are rocks and different situations, and I am pretty far out from the nearest doctor, the nearest hospital, and my risk of injury might be a little bit higher because I'm chainsawing, right? All of these different things play such a big role. And then the part of that question, at what point when you notice your balance isn't as great, should you schedule a doctor's appointment? Hopefully you are going for your annual exam, and at that time they are talking to you about your fall risk. But if you are noticing that you're just not feeling as stable on your feet, if you're noticing at nighttime when you have to get up and go pee and you're kind of doing the wall surfing, the counter surfing, right? It's past time to have those conversations with your doctor. If you're noticing different things, forgetting, keys in the fridge kind of a thing, all of these different factors, you're affected by light, you're affected maybe a little bit more by your different home environments. Those are times when it's so important to talk to your medical provider about your risk of falls. Did you want to add to that, Justis?
No, I think you did great.
Do you want to take into account people with issues such as knee problems or leg surgeries of some sort? Yeah. So in both of the different studies that we presented, orthopedic, we took into account. For the sake of this presentation, we did not present every piece of data, but that wasn't also the complete focus of either of the studies. If you've had knee surgery, how at risk of falls are you, right? If you've had hip surgery, but does that contribute? Oh, tremendously. Tremendously, that plays such a big role. And actually, one thing that I absolutely love and what I see in my clinic all the time is looking at strength and balance on one limb versus the other limb. Often, depending on where they're at in the rehab process, the affected limb, so the surgery dependent limb, is stronger. The balance is better on that limb because they've been focusing on it so much. So I say that in, hey, why don't we do both sides? Like, why not work on both sides and work on things together than just isolating? Yes, you need to rehab the affected leg, but we can also do both sides. Okay, have you examined fall results, injuries, muscle problems, broken bones? Yes, but it wasn't the focus specifically of these two different studies. What Tai Chi classes are available locally?
There's Tai Chi at the Adorni Center is one place that you can go. I believe they have one or more Tai Chi classes. There's also a woman that does, I think she does it in a variety of places, everywhere from like Sequoia Park, and it's called Tai Chi for Everyone. And I can put her schedule here in the chat for you. But I believe she holds this pretty regularly, Monday through Friday. The other place to look is the Humboldt Senior Resource Center, which is a nice overall. Sometimes their schedule that they post online is not always up to date. Sometimes it's better just to call them and get a sense of what programs they have. And here's their website. And then Area 1 Agency on Aging often keeps a list of where there are Tai Chi classes. You can also take, and it's kind of go ahead, Sarah.
There's also Humboldt Tai Chi, and that's located in Eureka, and they offer a variety of classes. I don't know enough about what they offer, but it looks like there's a variety of different.
Yeah, there's a few. I think also maybe Arcata, Arcata Rec does them. Sometimes they come in like seasons, like, they're doing the class in fall, but not in spring, or they're doing it in spring, not in fall. But yeah, Humboldt Tai Chi is another great one as well. So there's a few that are either, more public, meaning like run by the cities, things like that. And there's others that are run by individuals. And sometimes they're free and sometimes there's a small fee for those.
Have you considered having your students engage in providing classes with oversight as part of a practicum?
Yeah, and we have done that we partnered with public health over a number of years, where we would train the students in a course called A Matter of Balance. And it's a great course. Of course, when you're training the trainer, you have to have the trainer licensure, or, like they have to be certified to train other people. And some of the turnover or whether or not public health had the grants to do it, that has come and gone. So we've done that, and then it's like we get it and then it goes away, and we get it and it goes away. Sarah, do you want to expand at all on that?
Yeah, so we're constantly working with Area 1 Agency and public health, and like Justis said, grant stuff is, interesting at this time. But that's where we're also really excited about this new hub and to be offering. So another one of the questions was, will you be offering things via Zoom? Yes. We're working with UIHS right now on trying to figure out how we can develop and promote and get out there some online classes that are research-based, valid for our aging populations and just a great resource. And that's where this health hub should be a
We
great next step.
specifically designed the facilities so that we could literally have the classroom where you're doing the classes and it would stream, and we can record them as well. That's the nice thing. So let's say you're like, oh, I really wanted to participate in that Cal Poly, let's say matter of balance class, but I couldn't make it today. Or I know they're doing a seminar or they're doing a Tai Chi, where we can record these and then offer them for free to the community so that you can do it at your own pace or in your own comfort of your own home. But that is absolutely one of the primary goals of the Center for Healthy Aging and Fall Prevention in the new health hub. I mean, ideally, what I envision is you create these opportunities for folks to come in, get their fall risk assessed, where they can see where they're at, and then we've trained students in those sort of time periods, and they go, yeah, you're a great, based on our assessments, you'd be a great candidate for this class. Let's say the Tai Chi class, or what are you interested in doing? And then we can kind of get people into the right classes, and then those students go from assessing to delivering under mentorship from professionals these fall prevention classes to the community.
Have you considered doing a survey of OLLI members to find out what they'd be interested in from this standpoint of these issues?
They were a small subgroup in this, but we never found out, like we didn't ask whether or not they were OLLI. But yeah, we could do that with OLLI, for OLLI, saying, what would you be interested in? And then offering it. We did offer a fall prevention, like post risk assessment class for OLLI members. And we've done that in the past over the years, depends on the year that we were doing it. But it was very, 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 very popular. Let's just say that. It was great.
I bet it would be again. Well, any other questions from anybody? I think this has been wonderful, as it always is with you two. And so we very much appreciate your coming. This is our final Brown Bag Lunch Program presentation for the summer session, and we will resume on September 21st and look forward to seeing you then. You get a break in between, but we hope you've enjoyed these talks this summer and look forward to seeing you again.
Thank you for having us. And
We really appreciate it.
And if any of you know, either for yourselves or other folks, who you feel like might benefit from, having a fall risk assessment, please have them reach out. That it's our goal is to reduce falls here and make it so everyone can live the life that you all want to live, and your friends can live their lives the way that they want to live them. So please don't hesitate to send an email, make a phone call. I think I'm the only Justis at Cal Poly Humboldt State. Sarah just put her email in there. We're happy to do anything we can to support you all. So let people know about us.
Well, we're very happy that you agreed to do this, and it's helpful to all of us. So thank you ever so much. And but you are welcome to propose something for the spring, by the way.
Oh, yeah.
As a brown bag lunch. So come up with something. The proposals will be out sometimes, probably in September, October, for you to fill in if you'd like to do that.
Sounds good. Thank you, Jane.
And everybody
Thank you,
has
Jane.
a great
Thank you.
rest of their summer.